Welcome back. 11:22 on the dot now for your Thursday morning. And the American Cancer Society says more than 19,700 women will receive a new diagnosis of ovarian cancer this year alone. September, Ovarian Cancer Awareness Month, is a time where the disease is highlighted with the hopes of prevention and greater outcomes as a result. Dr. Michelle Rowland, a gynecological oncologist, I'm so sorry, with OSF Healthcare. It's definitely a mouthful. I'm not used to saying that many syllables. Joins us now with more. Dr. Rowland, thank you so much for being here this morning. Really appreciate it.
Absolutely, my pleasure.
Alrighty, so let's just do a brush up. I know many people familiar out home know what ovarian cancer is, but maybe if you would just kind of give a debrief as a refresher. What is ovarian cancer?
Yeah, so ovarian cancer really includes cancers that start in the ovary and the fallopian tube. And although they start in the ovary and fallopian tube, oftentimes people are diagnosed with this kind of being inside their belly or pelvis.
Absolutely. Obviously something that's very serious too. Talk about health tips. I mean, what can women look out for, and what are some preventative steps that maybe they can keep in mind too?
Yeah, absolutely. I think that the first thing is kind of being aware of changes in your body. So the difficulty is people sometimes say there's no symptoms of ovarian cancer, but they're not no symptoms. They're subtle symptoms, or they're confusing symptoms. So you may have changes in your bowel, maybe diarrhea or constipation, a feeling of fullness in the belly, finding that you're full. You eat a few bites of food and all of a sudden you're full and you never were before, or even pain in the belly or the pelvis would be there. And in terms of things to think about, we want people to be aware of those symptoms, asking their doctors, hey, what's going on? Can we do some additional testing? And, just keeping an eye out for those subtle symptoms.
Absolutely. Always good to be conscious. And then let's think about the post-diagnosis process. What does treatment usually look like?
So most ovarian cancers we're going to treat with a combination of both surgery and chemotherapy. So it's an intense treatment in which we combine those things to actually reduce what's going on with the cancer. And then long term these days, most of our patients are going to be on some sort of maintenance pill form of chemotherapy for a period of time after that as well, to try to keep this cancer away.
Got it. So a little bit of in-office treatment, a little bit of at-home treatment, is that correct?
Yes. The first part is usually pretty intensive with some outpatient chemotherapy, some surgical management, and then some home chemotherapy pills as well.
Of course. And obviously this is a very personal disease. This is something that affects many families, many individuals. How does OSF and the doctors that treat it, like yourself, how do you approach perhaps the actual personal treatment, making sure that they feel comfortable with what's going on?
Absolutely. I think that there's a lot of focus on the personal treatment in terms of the medicines, but it's also in terms of the person. And looking and visiting regularly with our patients, asking what their symptoms are, what else is it going on, how does it affect whether or not you're able to work, how does it affect whether you're able to take care of your family, be with your family. And we really try to provide a lot of supportive services to help people get through these difficult times and make it as easy as possible.
Absolutely. And I think you and I were discussing a little bit ago, as a male, we aren't as familiar with this disease, but of course we may know somebody, a partner, a wife, a friend who is going through that. What are some ways that men can be supportive of somebody they know who's going through it?
Yeah, I think just, there's a lot of ways people can be supportive. I think whether it's just a kind word of encouragement, a listening ear, and just being sensitive to the fact that it's a lot of changes that are happening in the body. And so for a lot of people that's very personal, especially if they're a younger patient with ovarian cancer. They may notice those changes a little bit more, and just being sensitive that that's difficult in addition to the therapy itself. Absolutely.
What might be some good resources that you'd recommend if someone just wants to learn more, or maybe kind of brush up on their awareness and knowledge of what this is?
Yeah, the American Cancer Society definitely has some excellent information on ovarian cancer. That's a good place to start. And then they have a list of resources as well about treatments, diagnosis, symptoms to watch for.
Excellent. Plenty of places to look for more information. If you want to learn more, of course, all month long we're going to be highlighting this, so there's no better time than now, Dr. Rowland, to check up. So thank you so much for being here.
Thank you for having me.
Absolutely. All right, we'll be right back in just a few minutes.